I now recognize the gentleman from Connecticut, Mr. Courtney.
Thank you, Mr. Chairman. And again, I want to join my colleagues in welcoming the Secretary back to her committee. And again, I appreciate the phone call the other day where we had a chance to compare notes on a number of issues. In particular, and you mentioned this in your opening remarks, your reference to using the registered apprenticeship program as the framework for expanding and growing apprentices is welcome. Message in terms of the Fitzgerald Act, which actually my predecessor in the 1930s, William Fitzgerald, was the sponsor of that law and has done great things all across the country and is the right framework in terms of setting national standards so that all across the country, people who see those certificates know that there's real quality behind that certificate. I wanted to focus for a second on one of the issues that is part of your mission, which again, Mr. Scott mentioned, is to guarantee the welfare of American workers, which is the OSHA. Your predecessor in the Trump administration, Secretary Acosta, actually commenced a rulemaking process for a workplace violence prevention standard in healthcare and social workers, which has still been sort of chugging along within the department. Again, this is a measure that is, in my opinion, to address an emergency, which is the incredible rates of violence that nurses, EMTs, emergency room physicians are facing at a frightening pace and rate over the years. This committee has done a lot of work in terms of the data collection that validates and demonstrates how serious this problem is. And the rule that is before your department right now is something which, again, we enacted twice in prior Congresses on a bipartisan basis, and there's a bill that myself and Mr. Bacon have introduced as well. But basically, it would set up a prevention system that is actually tried and true in some parts of the country, which provides training for medical staff in terms of how to de-escalate situations, basically identifying high-risk patients, whether in a psych hospital or an emergency room, which is where, again, the highest intensity of really serious injuries take place, and give, again, tools to people, whether it's panic buttons, systems of communication in terms of flagging high-risk patients that are there. And again, I want to just emphasize, Madam Secretary, this is a life and death situation. We have had incidents reported in from all over the country of people who've lost their lives because of inadequate safeguards that were out there. One of them is a 63-year-old home health nurse from Eastern Connecticut who was stabbed to death a couple of years ago on a home health visit. High-risk patient, actually was on a sex offender list and walked into that house completely sort of unequipped to sort of address what, again, ended her life. And, the tragedy still resonates today. So, again, it's gone through the small business SBREFA panel during the last administration. Again, the next steps are still ahead. And I really would ask your commitment to really making sure that the 15 million healthcare workers that are a huge part of America's workforce are going to see real action in your department in terms of advancing this rule.
Well, thank you, Congressman, and thank you again for the conversation on the phone. Just in a few seconds, I want to address the apprenticeships that you mentioned.
Yeah, I actually would like you to talk really about the OSHA. We agree on the apprenticeships. No issue there.
I will. My goal is 1 million apprentices in order to enhance that. We are taking a look at all of the rulemaking because I think it's key. I can speak to it from former congressman. That is one of the issues that I heard on the ground oftentimes was workplace safety. And now as the Secretary of Labor and understanding that is one of the core missions is to protect our workforce. No worker should ever have to determine whether or not they're going to go home safe at the end of the day. That is one of the core missions. It'll be something that I always look at. So in the promulgation of rulemaking, while I cannot discuss it while it's in rulemaking,
really, it's just a commitment to move forward. I'm not asking for details. Before my 20 seconds, I just want to make sure you know, over 30 professional organizations, American Nurses Association, American College of Emergency Room Physicians, Labor, who represents nursing and healthcare workers, including your father's union, the Teamsters, have endorsed this measure. And again, the burnout and the harm that is occurring out there threatens healthcare access in this country, let alone the life and health of the people who are the caregivers that are doing so much for it. So I really implore you to follow through what was started out in Trump 1.0 through the last administration and is now actively on the agenda of the Department of Labor today.
Well, I
With that, I
couldn't
yield back.
100% agree with you more, that we need to protect our workforce. My husband is in the medical field. I understand it dearly, and I will work with your office completely as we move through this process. Thank you.
I thank the gentleman. I recognize the gentleman.